Ever felt your heart race in an elevator or a crowded subway? You might be dealing with claustrophobia, an intense fear of confined spaces. Claustrophobia falls under the category of specific phobias, where people fear certain places, objects, or situations. Imagine being terrified of engine rooms, tiny or locked rooms, basements, tunnels, elevators, MRI machines, and even crowded areas. People with claustrophobia often avoid these places, feeling extreme discomfort and even physical symptoms like shortness of breath. It's not necessarily the enclosed space itself that's scary, but what might happen within it. This is similar to agoraphobia, where the fear is about having a panic attack in public. So, what causes claustrophobia? The brain plays a big role here. Certain areas like the amygdala become hyperactive when faced with fear-inducing situations. There's also a genetic component. A defect in the GPM6A gene can increase your risk. This gene is linked to stress responses, highlighting a possible hereditary aspect. Who gets affected by claustrophobia? Well, it's pretty common. About 7.7% to 12.5% of people will experience it at some point, and women are more prone to it. It's particularly noticeable in medical settings. Around 2.3% of people undergoing an MRI scan experience claustrophobia, sometimes to the point where they need to be sedated. When it comes to symptoms, they can be both physical and emotional. Imagine experiencing trouble breathing, trembling, sweating, a rapid heartbeat, or even chest pain. Emotionally, you might feel intense anxiety, fear of losing control, or an overwhelming urge to escape. Even though you know the fear is irrational, overcoming it can be a real challenge. So how do you diagnose and treat claustrophobia? Doctors typically start with an interview to understand the patient's experience with fear. There are also specific questionnaires and scales to measure anxiety levels. Cognitive behavioral therapy, CBT, is the go-to treatment, helping people understand and manage their fears. Techniques like interoceptive exposure and even virtual reality are proving helpful. For some, medication like benzodiazepines or selective serotonin reuptake inhibitors can also be effective. It's important to note that claustrophobia often coexists with other mental health conditions like PTSD, social phobia, or generalized anxiety disorder. While claustrophobia on its own doesn't usually lead to self-harm, it can exacerbate issues when combined with other disorders. Prevention and education are key. Understanding the signs and symptoms of claustrophobia can empower you to seek help and manage your fears better. Learning stress management techniques and avoiding triggers can also make a big difference. So if you or someone you know struggles with claustrophobia, remember, you're not alone, and help is available. If you like this video, like and subscribe for more content. MD Searchlight. Be your own advocate.